Bridge, New Frontiers in Type 1 Diabetes.
Diabetic ketoacidosis appears as a complication of stage 3 of type 1 diabetes because when the glucose levels are very high, insulin secretion is very small, and therefore the body utilizes fats and proteins to produce energy, and therefore produce also ketones. And these ketones determine the ketoacidosis.
Age at diagnosis has important impact on lifelong health of an individual who is diagnosed with stage 3 type 1 diabetes. So children, and particularly young children, they have a longer expected duration of the disease compared to adults. When the duration of the disease will be longer, the risk of micro and macrovascular complications increases, unfortunately. Another challenge related to age at diagnosis is that when we are talking about children and even adolescents, we have to educate also the parents, the siblings, grandparents, many people that live everyday life with these individuals, and then the patient, him or herself, lives through childhood, adolescence, young adulthood, all these developmental stages, and gradually takes more and more care in his or her own hands. So we know that during adolescence the metabolic control typically deteriorates, and that has some impact on the full picture of metabolic control over the course of the disease, and thereby affects the risk of microvascular complications.
I think that's a huge impact because diabetes is a disease that affects your life in every single aspect. It's 24/7, you can never take a holiday of it. It's a constant burden. And I think that's very heavy if you're like a newly diagnosed person. It's a lot to take in. It's instantly, there's no getting used to period, also not for your family, not for your partner. And I think certainly those first weeks are like a huge thunderstorm. You get diagnosed, you get admitted to hospital, you have to learn to inject yourself, maybe use an insulin pump, constantly monitor your blood glucose, but also take in regard what you eat, how do you move, do you do any exercise, do you any sports, and all those things are affected by diabetes. And I think next to like practical burden, the mental burden comes over time, because in those first few weeks you are overwhelmed and you think, okay, we will get this. But after like 3-4 months talking to your physician and getting to know what the complications can be of diabetes as well, I think that will be the next like thunderclap in the diagnosis. So I think it has a huge impact on people with type 1 diabetes, but also on their families and partners.
Bridge, New Frontiers in Type 1 Diabetes.